नवमी आप सब लोग आए और डॉक्टर सब्रवाल ने लीड किया। और साउथ दिल्ली ब्रांच सबसे बड़ी है तो मुझे पता है, सबसे अच्छी है ये भी पता है। इतने सारे इतने सीनियर डॉक्टर सारे लोग आए हुए हैं। ILBS is privileged today to have all of you. We are very thankful and I hope आप इसके बाद भी हम लोगों को कभी कभी याद करते रहें, साथ में रहें और हमें सिखाते रहें कि क्या और होना चाहिए, कैसे जुड़े। मैंने तो कहा था एक अच्छा मैराथन वॉकिंग, बट मे बी नेक्स्ट ईयर वी कैन प्लान इट। मैं आपको बहुत सिंपल उसमें बताऊंगा, विच आई थिंक ईच वन ऑफ यू वुड ट्राई एंड होपफुली एम्प्लॉय इन एवरी सिंगल पेशेंट. Why should we be concerned for fatty liver? I have nothing to disclose. So I'll divide this into three parts: science, actions and policies. Each one of you is a policy maker. You know that the liver stores all your extra calories, but it stores it as fat. Extra calories are deposited as fat. 2. Liver controls your blood sugar. It is not pancreas, it is the liver. Third, liver is the biggest immune gland. Which is liver, you all know alcohol, I'll not touch. Fat, I'll touch. Viruses, you know, hepatitis A to E. Now, if the liver in normal person has less than 5% fat, but if it is more than 10% due to excess calories or genes, then you have a liver which is more whitish, rounded margins, and it is full of fat. What does fat do to liver? Extra fat, how does it affect the liver? Now please pay attention to this. This is a fatty liver. All the cells are hepatocytes. This white rounded is a hepatocyte. Once such cells are there in the liver, the lymphocytes think it is a bad cell, kill it. And that is hepatitis due to fat, steatohepatitis. And the readout in the blood is high ALT level. So if somebody has high SGPT or ALT, there is hepatitis. This heals by scarring, which can be of grade 1 to grade 4 scar, and stage 4 is cirrhosis. And this can lead to cancer in 2 to 10% per year. These stages might require liver transplant. And all of you see diabetes patients. Just remember, in 100 cases of liver cancer today, 39% are due to diabetes. So if you see a patient with diabetes, just don't control sugar, prevent him from developing liver cancer. Let's go further. So somebody has fatty liver. This is pure fat, white cells. This is fat-induced hepatitis cell death. This can recover in a proportion of patients, and if it doesn't, it can lead to fibrosis. The fibrosis is around every single cell, classical chicken wire. So there is a fat and around that there is a fibrosis. This is called chicken wire fibrosis. Now this can lead to cirrhosis. Also without cirrhosis, liver cancer. So if you take 100 people, 20% of them may develop NASH or cirrhosis of the liver. Who will develop? Insulin resistance, those who have diabetes, blood pressure, obesity or genetic factors. Let's go further. What does surplus fat do outside? I told you liver. Now let's go beyond liver. Now here is a patient who is absolutely normal. He is a healthy guy. Normal liver cells. his blood sugar is 95. He uses 2 units of insulin and very happy in the morning. रात को खाना खाया, सुबह शुगर 95 है, 2 यूनिट इंसुलिन लगा. This is a guy with fatty liver cells. This guy also has blood sugar of 95. बड़ा खुश है सुबह उठ के. पर he uses 20 units of insulin. Normal range is from 2 to 22, पर ये 20 यूनिट लेता है इंसुलिन को. This is insulin resistance. The insulin does not get into your liver cell. More and more insulin is needed. So whenever you get fasting blood sugar, no need of A1C. Fasting blood sugar with insulin is the best way to identify pre-diabetes. Diabetes is a liver disease. Because of insulin resistance, over time, you develop diabetes. Let's go further. I have shown you fatty liver disease, the spectrum. I have shown you development of diabetes. Now you get your blood test. आपने पेशेंट का टेस्ट कराया, भाई तेरा कोलेस्ट्रॉल तो 220 है, ट्राइग्लिसराइड 300 है, फट दवाई लिख दी. बट ये कभी नहीं पूछा कि ये आया कहाँ से, फ्रॉम वेयर हैज़ दिस फैट कम. This is extra spilled fat from the liver, high cholesterol and triglyceride. And this deposits on the arteries. You get blood pressure, heart, kidney, bone, cancers, stroke and gallstones. So today, why should we be concerned for fatty liver? Is the most common number 1 public health problem. I'm giving you a very simple example. Many of you would know Framingham studies, 3rd generation. तो जिनके बच्चे 10 साल के थे और उनका ALT हाई था, वो डायबिटीज़ 5 to 20 times, by the time they were 25, डायबिटीज़ हो गई. जिनका ALT हाई है, दिस हून स्टडी में उनका 14 ईयर में डेथ डबल थी. तो आज वो 15 साल का बच्चा है, उसका ALT हाई है, फर्स्ट हार्ट अटैक बाय द टाइम ही इज़ 25. किडनी डिजीज़, दोज हु हैव फैटी लिवर 41% हैव मोर किडनी डिजीज़. डिमेंशिया, आप इतने लोग देखते हैं, जिन लोगों का फैटी लिवर हाई है उसमें रिस्क ऑफ डिमेंशिया बढ़ गया. बट द गुड पार्ट इज़, अगर आपने फैटी लिवर घटा लिया, डिमेंशिया का रिस्क कम हो गया. सो दिस इज़ द डेटा फ्रॉम UK बायोबैंक of 3,27,000 people of using fatty liver index. Now this is the most important. You have BMI, you have waist, you have triglyceride and gamma GT. 4 चीज़ें यूज़ करते हैं. These people were followed for 10 years. Those who have high fatty liver index means above 60, उनको हार्ट डिजीज़, स्ट्रोक, हाइपरटेंशन, lipids, diabetes, cancer, all cause, breast cancer, colon cancer, upper GI cancer, सारे ज़्यादा. So this is a summary. If you have high fatty liver index where waist, central obesity is more important, then you have fatty liver, high ALT, cancer risk 40% high, lipids 2.5 times, diabetes 4 times, hypertension 2.8 times, dementia, Alzheimer's, heart disease, stroke and low testosterone levels. So why should we be concerned, Sabharwal Sahab and others, Sanjeev? Because it affects each one of you. How common? So this is the data from Nature that countries in the red have more than 30% population, 30% से ज़्यादा fatty liver है. So if you take for India in red, more than 30 crores have this. And this is our Delhi data. Mohalla clinics those days, 56% of Delhiites, 1 in 2 has fatty liver. 11% पतले दुबले थे। अब आप अपनी प्रैक्टिस में बैठे हो क्लिनिक पे, 4 पेशेंट आए मेरे पास 1 घंटे में, 2 में फैटी लिवर, तो आपकी प्रैक्टिस कितनी बढ़ गई? आज आने का फ़ायदा हुआ कि नहीं? रामनवमी का प्रसाद मिल गया। If you are seeing 10,000 patients in a year, 5,000, now you have new patients. All right, let's go further. So how many patients in South Delhi? Now, briefly, actions. First is, do I have fatty liver? अब इतने लोग बैठे हैं 200, कितनों के होगा फैटी लिवर? 50%। अब आप पता लगा लोगे खुद ही, मेरी ज़रूरत नहीं है। एंड हाउ टू फिक्स इट? ऑल राइट, दिस स्लाइड यू कैन कीप ऑन योर मोबाइल because I am very fond of it and it will be very useful for you. So do I have fatty liver? डायबिटीज़ है तो भाई फैटी लिवर है, क्योंकि डायबिटीज़ से पहले फैटी लिवर था। इफ़ आई एम ओवरवेट और ओबीज, BMI ज़्यादा है तो फैटी लिवर है। और लीन एंड थिन है, बट माई वेस्ट इज़ मोर, माई BP इज़ मोर, triglycerides are high, HDL is low, A1C is high, or there is a family history, suspect, test, detect, manage and reverse fatty liver. So now you can very easily, the patient comes, भाई तेरे डायबिटीज़ है तो इधर हो जा, तेरे BP है, कोलेस्ट्रॉल हाई है, इधर हो जा। इसी तरीके से you can very easily plan your management. And I'll tell you more. This is the most important slide which has changed the world. कोरिया में 142,000 people went for health insurance, 35 to 59 years, in 1990 to 92. And they were followed for 10 years. Those who had a ALT or SGPT of less than 20, all-cause death or liver deaths were equal low. But if their SGPT or ALT was, say, between 30 and 39, all-cause mortality was 70% more and liver mortality was 900 times more. और सपोज सबको अपना SGPT पता है ना? आपको पता है? कईयों को नहीं पता। अगली बार याद से लिख लीजिएगा। मोर इम्पॉर्टेंट इन माई माइंड देन हीमोग्लोबिन। सपोज आपका SGPT 70 है तो आप किस कैटेगरी में आए? 3 times more heart disease, 30 times more risk of liver problem. This is just to symbolize one test of 30-40 rupees and you can say कहाँ जाना है क्या. So now let's go further. How to fix it? अभी देखिए बंदा कितना खुश है, ये बंदा कितना दुखी है और इसका लिवर. हाउ टू फिक्स? तो देयर आर 2 थिंग्स. फर्स्ट, लिवर में फाइब्रोसिस कितना है और बाकी ऑर्गन्स में क्या असर है. दिस इज द एल्गोरिदम. सो द पेशेंट हैज़ कम टू यू वेयर यू थिंक इट इज़ मेटाबॉलिक डिसफंक्शन एसोसिएटेड फैटी लिवर डिजीज़. तो आप पूछोगे कि भाई डायबिटीज़ है और कोई रिस्क फैक्टर, ओबेसिटी, हाइपरटेंशन, कोलेस्ट्रॉल है. तो पहला तो हिस्ट्री हो गई. फिर शराब वराब तो नहीं पीता और बाकी सारे आपने हिस्ट्री ली. देन यू विल डू अ सिंपल FIB-4. FIB-4 इज सिंपली योर हीमोग्राम एंड LFT. आप सब अपने हॉस्पिटल में शुरू कर सकते हैं. यू कैन जस्ट प्रोग्राम इट. हमारे यहाँ आप LFT हीमोग्राम कराएंगे, FIB-4 आ जाएगा. FIB-4 इज एज, AST, प्लेटलेट एंड ALT. कुछ नहीं है. अब पूरी दुनिया इस पे चलती है. FIB-4 2.67 है, भाई हाई रिस्क है, तो जा रेडियोलॉजिस्ट से CT करा यार. FIB-4 लेस देन 1.3 है, कोई रिस्क नहीं है, आराम से साल के बाद आना. FIB-4 1.3 से 2.67 है, फिर आप फाइब्रोस्कैन कराएंगे. अगर 8 से 12 के बीच में है तो स्पेशलिस्ट को भेज सकते हैं. आप भी स्पेशलिस्ट हो गए, अभी के बाद में यू आर ऑल स्पेशलिस्ट, यू विल हैंडल इट योर सेल्फ. बट इफ इट इज़ अबाउ 2.67 और फाइब्रोस्कैन इज अबाउ 12, ही रिक्वायर्स more attention. Now managing, fixing it. We start today, right now. Kyun South Delhi branch has decided? Everybody's fatty liver is fixed in next 30 minutes. All right. First is change your attitude. यार उसके भी है, इसके भी है, doesn't matter. अगर यहाँ fire लगेगी, you have to do a fire extinguisher. So first thing is consider liver fat as a fire alarm. This is a simple method of how do you handle. BMI 27 तक है, lifestyle, behavior changes, healthy eating, physical activity, you know all this. BMI is up to 30, calories very low, 800 to 1000 calories, sometimes even 600. Then you might say, साहब ये नई नई दवाइयाँ आ गई, and I'll show you that anti-obesity medicines or bariatric surgery. Don't go to that stage. So current management of fatty liver. So the patient has come, you will say he is obese, he is lean, he is normal weight. He is diabetic, non-diabetic. Does he have fat, adiposopathy, or has he been exposed to early life antibiotics? Then you will decide what is to be done. And we do gene analysis, very cheap, just 10 or 12,000 rupees, 22,000 genes are done, whole exome. So you will know यार genetically माँ बाप से मिला इसे, bacteria गड़बड़ है. Then you will say, does he have only hepatitis, non-alcoholic steatohepatitis, HCC, cirrhosis, decompensate. And then the treatment can be decided. All of them have weight loss, diet and exercise. And there are several new drugs, and I will rush through it in the interest of time. Saraglitazar is an Indian drug all of you are using. This has the benefit of slightly slowing down the ALT, liver fat, insulin resistance, dyslipidemia, but is mildly effective. I would say 3 out of 10. There are new therapies. One is, all of you know, semaglutide, liraglutide, and the newer generation GLP-1, GIP-1, tirzepatide, just launched survodutide. Now all these drugs do what? They break down lipids, lipolysis, fat oxidation, insulin sensitivity is increased. There is another group of drugs which is approved in the US, thyroid hormone receptor agonist, resmetirom, I'll show you. And another one is FGF21 analogs, which increases the burning of fat in the fatty tissue. So 3 groups of drugs are now there. Let's say first semaglutide. All of you are using Rybelsus or Wegovy and others. So if you are giving 0.4 milligram, weight loss is 13% and resolution of NASH is about 59%. Some of them have side effects. Now Mounjaro just launched. It is used for stage 2 or 3 fibrosis, 15 milligram dose, again resolution in 60% compared to 10% in placebo. Fibrosis reduction can be seen. The third drug, which is resmetirom, available in the US, it is an oral pill. Resolution is 30%, fibrosis reduction is 26%, weight loss hardly. But the cost is about 5,200 for 1 month. And you may have to take for 2 years. उतने में वैसे ही पतले हो जाएगा बंदा, वैसे ही सारे पैसे ही खत्म हो जाने हैं. Incretin based, this is a new very powerful drug, survodutide by Boehringer Ingelheim, 4.8 milligram, again resolves NASH and reduces fat. And now the last group of drug is FGF21 analog, which is also we are using this very often as a clinical trial. If you have a patient, any of you have a patient of fibrosis or cirrhosis, they can be included. These trials are on globally, so they can be enrolled for trials for stage 2, 3 or even for cirrhosis liver. So this efruxifermin is a good drug and also can be used. Now policies. So as Dr. Sabharwal and Dr. Rewari Sahab told us, about 4 years ago, Government of India adopted fatty liver screening into the national program, making India the first country in the world. Why should we be concerned and why should we do all this fatty liver reduction? This again is a Korean study. Please remember this study. 3 million Koreans, 3 million, 2009 to 13, in them fatty liver index was measured. जिनके नहीं था फैटी लिवर और फैटी लिवर हो गया, उसमें डेथ ज़्यादा थी, हार्ट, डायबिटीज़. But the more important is those who had fatty liver earlier and it decreased. The death decreased by 17%. कुछ नहीं किया. Just fatty liver reduction and you have an improvement in these survival things. So I would like to say, keep time for liver. Liver day is coming. I have not given you too many advices on diet and food, which all of you are aware, but I would like to say that South Delhi branch, keep every one of you as healthy liver and also all your patients healthy liver, so that we have a healthy country. Thank you.